Hello, friends. Welcome to Parkinson's EmPower Talks, a journey of empowerment and understanding for living your best life with Parkinson's. Kick back, relax, and get comfortable. We're here to make your Parkinson's journey just a little bit easier. I'm your host, Dacy Reimer. I'm a nurse practitioner specialized in movement disorders and the Director of Medical Advising and Education for the Wisconsin Parkinson Association. The Wisconsin Parkinson Association's mission is to provide hope, community, support, and resources for people with Parkinson's and their loved ones. Hello, everyone, and welcome to Parkinson's EmPower Talks. My special guest today is Marie Mejaki, and she is a clinical trial research manager with the Medical College of Wisconsin. And we are going to be talking about volunteering for Parkinson's disease research, what to know and what to expect. Welcome, Marie. I'm so happy to have you.
I'm very happy to be here. Very happy to chat with you today.
So let's talk a little bit about you first, if you don't mind. Give us a little background on like your education and how you became interested in research in general, because that's a niche. That's not something that everybody tends to know a lot about or goes into for a career. So tell me a little bit.
Yeah, definitely. Even still, if I tell people what I do, they're like, what's that? So yeah, my name is Marie Mejaki. I am a research manager at the Medical College of Wisconsin. I've been there for about 8.5 years now. And I've worked with a lot of diseases in my time at MCW, but I've always worked with Parkinson's and movement disorders and clinical trials in Parkinson's. So a little bit about my background. I have a bachelor's in psychology. We kind of joke at MCW that everybody with a psych degree just kind of ends up in clinical research, but it's kind of true. So I had a little bit of research exposure in my undergrad. I worked in a lab with one of the professors for aging, imaging, and memory, and I just really liked it. She actually recommended that I apply for a job at MCW, and everything just kind of fell into place, and I've just been here ever since. So, yeah, it is a little niche, but I really enjoy it.
I don't know if I told you this, but my oldest daughter, Kirsten, is at MCW in CTSI. So into
Oh, yeah. Okay.
and
Nice.
she has a degree in psychology. So,
Oh, see, there you go.
right. So tell us a little bit more. Let's start talking about clinical trials. Like what is a clinical trial? What is that so that people understand it?
Yeah, that's a great question. So, I will give you a definition that the World Health Organization defines a clinical trial, but then I'll kind of break it down a little bit too, because there's a lot that goes into clinical research and what is a clinical trial. So the World Health Organization defines a clinical trial as a type of research that studies new tests or treatments and evaluates those effects on human health outcomes. So, in other words, it's a really regulated, organized, standardized way to study new potential therapies, treatment options to determine their safety and effectiveness. So there is usually oversight from the Food and Drug Administration, other governmental agencies, depending on the country that you might live in, institutional review boards. At a minimum, there's a lot of groups that oversee and coordinate clinical trials to make sure that everything's done correctly and done safely. So there are kind of two categories of trials. So I'll kind of talk about those. The first category is observational studies. So this is basically exactly what it sounds like. In an observational study, we just observe somebody, the way they are acting, the medications that they take. We don't make any changes to anything. And this could be for a couple of reasons. We might just want to look at a diagnostic test. We might want to compare it to another test. We might want to look at the medication they're taking, compare it to another medication. So usually it's kind of what is this doing? How does it compare to other treatment options? Observational studies could also look at genetic components. So we could look at a person's genetics to gather biomarker information just to better understand that genetic cause and kind of how it correlates to health changes or a certain diagnosis. So that's one category. And then the other category is more treatment studies. So this is more my wheelhouse. So a treatment study is also exactly what it sounds like. We look at a new therapy for a particular disease or disorder. So it could be a new medication. That, again, is kind of my wheelhouse. I mostly work on clinical drug trials. But it could also be a surgical intervention like a stem cell transplant. A treatment study could also involve a device. So, like in the cardiology world, it could be a new type of pacemaker. In the PD world, the Duopa pump's a great example of that. So it's a device that was studied under a clinical trial and recently, well, in the last couple of years, approved for the treatment of Parkinson's. So those are our two main categories.
A lot of my patients or people that I've known have been involved even at like Madison and like Alzheimer's research. So their
Mhm.
families have been observed over the years in some of those observational studies, and there are some like that with Parkinson disease nationally as well. So yeah.
Yes, yeah, definitely.
Oh, my
We actually
background.
participate in one of those projects. It's PD generation, so it's a genetic registry, and they have the PPMI study, which is like a long-term biomarker study. So yeah, lots of
It's
observational studies
interesting.
like that.
They're totally different types of research, but both really
Mhm.
interesting and something that people might want to get involved in.
Yeah, for sure.
And then, like, how are, what's the process? Like, how are new treatments actually approved?
Yeah, so through these clinical trials, these therapies go through this very regulated, very rigorous process. So there are different phases of clinical research. So I'll kind of give like a high level overview of all of them. So the preclinical phase is really like before we even like start working with a human subject. We're still kind of studying a treatment option or a medication in the lab or maybe on animals, really determining should this medication be tested in human subjects. So if you see positive data from your preclinical studies, then a medication or a treatment option moves into a phase 1 trial. So phase 1 studies are usually done in a smaller group of patients, but it's our first in humans subjects trials. So purpose of a phase 1 study is really to look at the safety of a medication and make sure that it's safe for human subjects. If everything goes well in your phase 1 trials, then you move on to phase 2. Phase 2 studies are usually done in a slightly larger group of patients, usually within the disease that you want to study. The purpose of a phase 2 study is really to look at safety, kind of confirm the data that you've seen in a phase 1 study, look at tolerability of a medication and effectiveness. And you might also look at like an optimal dose if you're looking at a medication option. If you're looking at multiple doses, you want to identify that within your phase 2 studies. If everything goes well with phase 2 studies, you move on to phase 3 studies. Those are usually done in larger groups of patients, maybe a couple hundred, couple thousand patients. The purpose of phase 3 studies is really to kind of confirm all that information you've seen in your earlier trials. So really determine the safety, the tolerability, the effectiveness of your medication. We might also look at more extensive or long-term data in phase 3 studies as well. So the goal of all of those, again, in some fashion, is really to look at safety, tolerability, effectiveness. Just kind of depends what phase you're in. That determines what the primary focus is. So that's like a really quick timeline, but in reality, each of those phases can take years to go through. So, going through FDA requirements, other regulatory requirements, recruiting all of the subjects for a study, getting them through all of the study visits, analyzing all the data, that process can take years. So this is definitely a very slow moving, involved process, but it's really just to make sure everything is done properly and safely. So once you kind of move through all of those phases, the FDA ultimately has the responsibility to approve treatments or new therapies. So they really look at all of the trial data to date. They want to confirm positive results that have been seen. And really, the biggest thing is to confirm that the benefits of this therapy outweigh the risks. So, if there are risks, are they well managed? Are there ways to mitigate these risks? Putting patient safety is always like first top of mind.
Yeah, and I think a lot of times people wonder why that, why it takes so long to get new medications or why we're not advancing in the world of Parkinson's treatment faster. And that's because this is just such a long phase, of steps of phases and things and it's also important, I think, for people to know that because if they do get involved in a clinical trial, yes, it might be that study for that phase of the trial, but it could have some extensions too as they go along that they for open enrollment for those other extensions. And it could lead to a more lengthy period of research as well. So I think it is really important to know what those stages are so that you're aware of where you are in that process and how long you might be involved in those clinical trials because we do need long-term data too.
Exactly. Yep. Absolutely correct.
Super. And then, why is it important for people with Parkinson's to participate in research?
It's a great question. One of the physicians that I work with, actually, every time he sees one of our study participants, he always says, "Thank you for doing this. This is the only way that we get useful data. This is the only way that we learn." And that is absolutely true. We can't find better treatment options. We can't find a cure for Parkinson's without people participating in research. Even if somebody gets involved in one of the observational studies, something that's a little less invasive or a little less involved, we still get so much useful information from that participation, from that trial or that project. So, yeah, it's just really essential that people are willing to participate in any way that they can to really further science and improve patient outcomes, all that kind of stuff.
I think about how many years I was involved in clinical trials and how many medications were approved for use. And then as a clinician, get to see them used and
Mhm.
how life-changing it can be for people. But if it weren't for us doing those initial clinical trials, they wouldn't be there. And so, yeah, it's always a process, and it's a matter of whether or not you decide you want to get involved in that process. And it's such a personal choice, of course.
Yes, absolutely. Yeah.
So if say you are a person, anybody that's listening is a person who's interested in getting involved in clinical trials, tell us a little bit more about what they should know or what they should expect with that.
Yeah. Well, I'll start by saying that a research trial is very different than your clinical care. Very different than when you just go to see your doctor at the doctor's office. There's a lot more that goes into it. So I'll start by saying I think probably a lot of people don't know that a lot of trials have eligibility criteria that are required to participate, and somebody has to meet those criteria to be able to participate. This is almost always for safety reasons. So, if somebody has a medical condition or is taking a medication that could potentially interfere with the therapy or the treatment that we're studying, or could be worsened by participating, then we never want to take that chance, right? We're going to exclude that person just to protect their own well-being. I will also say that eligibility criteria do kind of help us cherry pick patients a little bit. So this is a huge discussion in the clinical research world. Researchers try to find this perfect balance of having the most inclusive trial population, including as many people as possible, but also making the criteria strict enough that you're going to see statistically significant results and positive data. So trying to find that balance is tough sometimes. Um, And then what else? I think the other thing to keep in mind is there is and there has to be a separation of your clinical care, somebody's clinical care with a research project. So that's because research is voluntary. We never force anybody to participate if they don't want to. But also research should never ever interfere with somebody's regular medical care. So because of that, there are usually different visits and assessments that are required to participate in a research project. So research visits, the frequency kind of depends on the study and the therapy or the treatment that you're looking at. Some are maybe a little less involved. We see you every 6 months. Maybe you come in once a month. Some studies are a little more involved, so you come in once a week. It just really depends on the study. But then within those study visits, we do a variety of assessments. So some of these things might be things that you do or that the patient participating would do. So maybe like questionnaires that they answer about their health. There might be questionnaires that the physician assesses about their Parkinson symptoms. We usually do a lot of safety assessments as well. We draw a lot of labs. Maybe doing ECGs to test heart rhythm, or maybe some imaging like an MRI. Sometimes trials require patients to do things at home. So a lot of our Parkinson's trials do require patients to track their symptoms at home via something called a Hauser diary. So assessing every 30 minutes, how am I feeling right now? Do I feel like my meds are working? Do I feel like they're not working? Am I having dyskinesia? Sometimes they have to track their medication if they're in a medication trial. Did I take it today? What time did I take it? So it can be a pretty involved process for sure. And again, some of these assessments that we do in a study visit are a little repetitive to clinical care, but again, it's just because we always have to maintain that sense of separation. And then I think the last thing I would say is that research studies usually cover the costs of any therapies or treatments that you're getting, any of the assessments that are done. Somebody should definitely always confirm that before they decide to participate. But I would say for the most part, those things are covered when you participate. It's really just, people giving their time and energy to coming in and to participating in a research study.
That's fantastic. I think it's so important to know, for them to know too, that the clinical trials don't replace their own doctor, especially if it's somebody that they really trust and that's their care partner, that these visits are all in addition to your regular visits. And so you still get to see your neurologist or your movement disorder specialist. It's just that you might have maybe even some duplicate blood test or testing that's done, but it doesn't mean you have to leave your current provider. This is an addition to that. And same with all of those tests performed. And it might seem overwhelming, but all of that's discussed prior to even joining the studies, that you get an outline of how the cadence of those visits, how often you need to come and what'll be performed at each one of those visits. So everybody's informed ahead of time. It's not something that you're going into it going, I don't know what's going to happen at my next visit. You guys lay that all out there for them so that they're really well aware and very educated on what's going to happen in that clinical trial so they can make that decision.
Exactly. Yep.
And important to know too that if any time they feel like they don't want to participate anymore, they can always withdraw. That's always that freedom in there. They're never held to having to do it. It's always a personal choice.
Exactly. Yep. Super important for us. Yep. Top of mind.
Oh, how often, how many clinical trials are you guys doing right now for Parkinson's? Is that something?
Yeah, that's a great question. Right now, we have two clinical trials that we are running. So one is more for patients who are a little more newly diagnosed, not on any anti-Parkinson's medications right now. And then we also have a study for kind of the flip side. So patients who have been diagnosed a little longer, are taking carbidopa-levodopa or Sinemet, or Rotari, and are having issues. So maybe they're having a lot of dyskinesia as a side effect. If they're having a lot of motor fluctuation, so they feel like the meds aren't carrying them through to the next dose. So those are our two clinical trials. And then I think I mentioned earlier, we are also participating in PD generation. So it's like a genetic registry project that patients can consent to get genetic testing for Parkinson's. They can choose to be informed of those results or not. And then we kind of save that data and that sample to use it to basically just study whatever we think we can study that'll be helpful for understanding Parkinson's better.
And that's, that's exactly what you were talking about before with, the fact that you have what we call de novo, or for people who are really not on medications for Parkinson's or early in the disease process versus those who might be more advanced in the disease process. That's some of that inclusion exclusion criteria that they have to meet. And just having that variety. So whether it's not necessarily something that they just hop in and say, yeah, I want to participate. You guys get to help. You have to help make that choice because you have certain kind of endpoints or certain uh, theories that you're trying to basically solve, and so they have to meet that criteria. So tell me a little bit more about how our listeners can get involved in research, both locally. So, obviously they're at MCW and maybe in our state, and then as well as national. What are some of the resources that are out there for them?
Yeah. So, yeah, we already kind of talked about MCW. I was going to put in a plug for us, but yeah, we usually are doing at least one clinical trial, if not more, for Parkinson's at Frederick and the Medical College of Wisconsin. I will say, I think we kind of talked about this too. There are some other bigger institutions around us that also usually participate in Parkinson's related research. So Mayo Clinic, Northwestern, Rush University, kind of around us. So you can always check their websites and see if they are currently enrolling for Parkinson's related studies. Um, Probably one of the bigger resources I would say is clinicaltrials.gov. That's kind of like the standard for looking up current research that's happening. You can filter it by any type of disease. You can filter it by studies that are currently recruiting patients or maybe soon to be. You can search any location in the world, any study that is, a lot of studies are required to use clinicaltrials.gov to be logged. So that's a great resource. And then I would also say Michael J. Fox Trial Finder is a really great resource specifically for the Parkinson's community. So it's kind of like clinicaltrials.gov, but it's already filtered for Parkinson's related studies and other movement disorder studies. So you can also kind of search by location and, if things are currently enrolling or maybe soon to be.
Sure. Thank you. I appreciate that. And everybody always asks clinically, how do I get involved, or where do I find websites for clinical trials? Are there any going on in my state or nearby? And that's a big factor. So you've got to be able to, especially if you're initially in a study once a week, you've got to be able to make it there. And it might be running through the winter too. So you've got to find something that's local and realistic to be able to attend all those visits. So
Yeah.
I want spotty data.
Yeah.
So let's kind of wrap things up a little bit. If you were to give our listeners one piece of empowering advice, what would it be?
I think maybe just in the spirit of our conversation, just, if you are willing and able to get involved in research, we it doesn't even have to be anything related to Parkinson's. You can always volunteer for smaller projects that are going on at MCW or other institutions. Um, I think it's just really essential for people to participate, to be able to move science forward. I think it's really empowering for people to be proactive about their healthcare and involved in their healthcare making decisions. And, I think to some extent, research is healthcare, maybe not necessarily for you directly or for somebody directly, but for future patients who, have to deal with this disease or with any disease or diagnosis. So, I think it's just essential to just developing better treatment options, curing or eradicating certain diseases. So I think that
Or
would be
the
my
genetic
advice.
studies, because I mean, we all have families and you want to know more about it, even just for the next generation. So, yeah, I agree.
Exactly. Yeah.
Well, I really appreciate you taking the time today, Marie. It's been such a pleasure getting to know you and more about your line of work, and for our listeners, more about how to get involved in Parkinson's research and what that entails. So, thank you so much for stopping by today and sharing all of your wisdom. We appreciate
Yeah.
it.
Thanks for having me.
Sounds good. Thank you. The Wisconsin Parkinson Association is a grassroots organization funded by people like you. To support more local programming like this, visit wiparkinson.org.